We've all been patients at some point of our lives, and this is what we make medics pass through. Well, if you're a medic, I'm sure you're going to understand and you're going to agree with most of the points that I'm going to state today. If you're not a medic, then you are at the right place. Well, it's a high time that you knew of the challenges that you make medics pass through as they try to help you in the journey of treatment. I hope you're going to enjoy this video today. I'm here to just bring that community awareness, and yeah, let's walk through. I'll be your host, Erin Oira, and without taking any more of your time, let's dive in. The first instance encountered is uncooperative patients. You find that the patient is given and explained to of how the treatment plan is going to go. So we are going to start from this point to this point to the next point. But now you find that the patient is not willing to follow through. Well, the patient experiences skipped sessions, you experience not following through that plan, and somehow not being open to the exercises or the medication that the patient is supposed to take. Well, you find that most of these conditions are long term, so there's that essence of giving up along the way, there's that essence of getting tired, there's that essence of not agreeing to the treatment plan that is put in place. The second instance that I have noted is the angry, the rude, the abusive, or the disrespectful kind of patients. We all have problems, we all have issues. So when you come to the facility to seek medical attention, please try and try and shelve all the insults that you've got, all the abusive words, because, well, to be honest, the medical personnel is there to help you. So if you by any chance don't agree with what you are being told, then it is just polite to maybe keep silent or just walk away, or just inform the person that you are not really okay with what he or she is telling you, instead of using insults, instead of being so disrespectful. Because also on the other end, try and understand that also the medic is also a human being as you. So when you wear that shoe that the medic is wearing, are you going to feel okay? Are you going to be really comfortable handling such a person? Are you going to help this person with a clean, open heart? So I think that is also something that patients should also consider as they go to seek medical advice. The illness is really limiting you in so many aspects of your life, but also try and put yourself in the shoe of the medic and ask yourself, if someone came and abused you, if someone came and disrespected you, if someone came and got rude with you, how are you going to feel? Are you going to help them in the fullness of how you want to really help them? Please, patients, be aware that you are also interacting with a human being. The third thing that I have observed, the Google kind of patients. Well, it is so interesting that you have come to the facility to seek medical attention, but you already have a list of how you expect me to handle you. And some of the patients, you'll find that they researched in the wrong kind of sites. You find that some of the patients are researching, but they are not fully aware of the particular kind of illness that they are suffering. So you just went to Google and you Google the kind of symptoms that you have, and you have concluded that now I'm sick of this and such a condition, and the doctor is supposed to prescribe this kind of medication, the doctor is supposed to ask me this kind of question, and you find that even these sites are not even medically certified. So you come there with a set mind of how you want to be handled, which is really not okay, because you came to the facility to seek the medical attention, and you came to people that are knowledgeable of your condition. You came to people that have gone to school to study your condition. So when you come there and start counteracting with whatever you Googled, it doesn't really augur so well, because if you knew what you are treating, then it's better off that you stayed at home. So also that is also a challenge. Please, if you have to Google, please just make sure that whatever you Google is just for your own personal knowledge. But the moment that you have decided to come to the facility, kindly be respectful enough to allow us to handle you in the best way that we know. Well, I'm not saying that Googling is wrong. No, I did not state that. It's also good to Google and to just make yourself aware. But now Google in the medically certified sites. But now when you come to the facility with your Google information, just bring it as a question, not bringing it as how you want us to handle you. Just bring them as a question, because some of the things that you Google are really not true to the facts of how you are supposed to be treated as an individual, because in most Google sites they usually generalize, especially the uncertified medical sites. You find that they just generalize the condition, but now you have come with maybe 2 or 3 of the symptoms, and some of the symptoms are not even in the condition that you Googled. So when you come with the information that you have Googled, make sure that you bring them in as you interact with your medical personnel. Bring them in as maybe questions, as concerns, so that we can wholesomely be able to come at par and be able to treat you in the best way that we have. But please don't come with concluded information of how you expect me to treat you. If you found that you're supposed to be given this drug and that is what you Googled, and I'm not giving you that drug, please don't see me as a quack. Don't see me as someone who is not knowledgeable. No, I'm handling you as a person, as how you are, as how you have brought yourself with your symptoms. The fourth thing that I have encountered is language barrier. Generally, in a hospital setup, the most commonly used language is English and Kiswahili. So when you find that you have a patient, that you have a sister or brother or your relative that wants to seek medical attention, and you are fully aware that the relative is not knowledgeable of the 2 common languages used in hospital, please make sure that you accompany them, or make sure that you look for a person who is going to be an interpreter, so that we can be able to tackle you in the best way that we can. Because when you speak in this language, I am not even from that tribe. Now you're forcing me to stop handling you and start looking for an interpreter within the facility, and I'm ending up inconveniencing another person who is supposed to be handled by this person that I have brought to help me in the interpretation. The fifth thing that I have observed is lagged payments. Well, if you have gotten the medical aid that you needed, why are you straining in paying? Because even if there is this notion of when you are a medic, you are doing it from your heart. It is service to the community. Yes, I don't dispute. But now remember that we also have bills. Don't strain us in trying to follow you up in paying for the sessions. Don't see us like as if we are just there, out there to eat your money. In most instances, this happens after you are healed. And now you wonder, if I didn't handle you in the best way that I did, could you be really well? Could you really be in this position that we are now talking of the payment? So it's only fair, it's only proper that after receiving the medical attention, please just pay without having these negative notions of how we are out here to squander your money. It's only fair that after service you pay. The sixth thing that I have observed is gender preference. Well, in hospitals, you find that there will be ladies and gentlemen. So when you come and you want to be handled by specifically a gentleman, and the one who's supposed to take care of you, take care of your health, but you want a certain person to come and treat you, it really doesn't sound well to us. Please, when you come and find a particular person in the office, it could be not the person that you are used to. It could be not the face that you are used to, but this person is knowledgeable as well as the other person that you are used to. So it's only fair that when you find me, or when you find another person, and this person is ready to help you, just be open enough, be open-minded to be handled with any person, with any medical personnel that is ready to give you assistance. The seventh thing that I have observed is missed doctor-patient time demand. What do I mean by this? You find that the medical personnel is there, presently trying to take your history, trying to take the nature of your condition, trying to gather some information from you, but as a patient, you're busy on your phone, you're busy chatting, you're busy on call, you're busy interacting with the relative that you came with, you're just not fully present in the interaction between me and you. It is just fair to just inform the person, please let me call you, I'm in the doctor's office. So instead of trying to balance, trying to multitask, entertaining this person, entertaining me, entertaining the relatives, you're just missed in this interaction between the medical personnel and you as a patient who has come. The eighth thing that I have observed is switched assessment time or switched session time. So this is where you find that as a patient, you're supposed to be ready by, let's say, 10 a.m. Well, this mostly applies in the patients that are admitted in the ward. So you find that at 10 a.m. you're supposed to be ready, because I'm going to come to your ward, I'm going to come to your bed to make some assessments so that we can start off our session. But at that 10 a.m. is when you want to go and brush your teeth. That 10 a.m. is when you want to go and wear your clothes. That 10 a.m. is when you want to go and take a shower. That 10 a.m. is when you are going to remember, oh, I didn't take my porridge. That 10 a.m. is when you're going to remember that I didn't do this and that. So you're there making me wait for you for the time that you were supposed to be ready, you're not ready. So inconveniencing the both of us. The ninth thing that I have observed is lack of transparency or withholding some information from us. This mostly happens during history taking. Maybe I want to know if you do take drugs. Maybe I want to know if you have ever interacted with such and such a thing. Maybe I want to just find out the basic cause of your condition. But now I ask you some questions and you're not open to share truthfully of what I'm really trying to find out from you. So you find that there is no transparency. You are not open into answering my questions. You're not open into giving a proper history. So you find that there is some missed things in the history as I'm taking your history as a patient. So when you choose to go to the facility, please make sure that you're open enough. Whatever information that you're giving the medical personnel is fully confidential. The other thing that I have observed is over expectation from the patient concerning their healing. Maybe you know someone who knows someone, or maybe you have a relative or a friend who got ill with a similar condition that you had. This person maybe took 3 months, 1 month, 1 year to heal, but now yours is taking maybe longer, and maybe the stages of healing are not the same. So you find that there is this over expectation of patients to heal in the same way as a person. Well, considering that we are all different people, we heal differently, we respond differently to medication. So it's really not a basis of branding this medical personnel that you're working with to be a quack. And in most instances, you find that the patients bring that up, that I had a sister, that I had a cousin, that I had someone who had the same condition, and by this time, this person was able to do this and this and this. Why am I not being able to do this and this and this? Well, it's really not good to compare the treatment, because we respond differently to treatment. It doesn't mean that I don't know what I'm doing. It just means that you are a different kind of an individual. You're a different person, and your treatment stages are going to be different. The other thing that I have observed is on and off appointments, if I could call it. This is where you find that the patient, whether admitted or at home, just cancels the sessions without any basis. You find that today the patient is going to tell you that please don't come, tomorrow please come, the other day let's postpone today's session. Or even in the ward, you find that they are there saying that today I cannot do the session, let's check in tomorrow, you come tomorrow, and this person is saying I did not do this and that. This person says no, let's also skip today, let's check in tomorrow. So there is that inconsistency in treatment. So you find that you experience that on and off appointments, and this makes you also lag behind in your healing. And then at the end of the day, there's that pressure of why am I not healing? Why am I taking too long? Yet, you are the one who is cancelling the appointments. You are the one who is on and off with your treatment. Well, that's it for today. I hope that I have made you aware of the challenges that you make medical personnel to pass through. I just hope that I have really brought that awareness to you concerning the interaction between you and the medical personnel. See you in the next video, and thanks for your time.